Good afternoon. I'm Kristen Bandy with Arkansas Children's, and I am joined today for our Facebook Live on incontinence by Sally Puckett. She is an advanced practice registered nurse here at Arkansas Children's, specializing in urology. Welcome.
Thank you
for joining us on this beautiful Friday afternoon.
Happy to be here.
Great. And so, like I said, we're going to talk about incontinence today.
Yes.
And so, first, I'm going to ask you, what drew you to the urology department?
Well, it kind of found me. So I was a just bedside nurse in the burn unit at Children's for several years while I was finishing my master's degree in advanced practice in pediatrics. And nearing the end, I started kind of seeing what jobs were available, and urology was one. And so I reached out and was visited by the chief of urology, Dr. Cannon at that time, and the nurse practitioner that existed there on the burn unit one day, kind of like a surprise visit.
Did you know they were coming?
I did not.
Oh, wow.
I think they were scoping me out.
Put you on the spot, huh?
Yeah, and so, and ended up having interviews later and applying for the job, and that's kind of how I got into urology and found a hidden passion there.
Nice. And how long have you been at Children's?
I've been at Children's in this advanced practice role almost 8 years. Prior to that, I think I was in the burn unit for 4 or 5. Something. I think it was in 2012 I started there.
Awesome. So urology for 8 years, you said.
Yeah.
Awesome. Well, what we're talking about incontinence today, and I will admit that I had to look it up to make sure that I knew exactly what it was. So tell us a little bit, what is incontinence?
So incontinence is the involuntary loss of the bladder, of your urine, whether you're awake or asleep. Traditionally, I think we call it other names. So you may say, my child wets the bed. So bedwetting, that's a type of incontinence. You may say, so-and-so pees on herself. So urinating on yourself during the day. Accidents is their most common name. All of that is incontinence. And the key really is that it's not intentional. It's unwanted.
Accidents.
Yeah.
Right?
Yeah.
Okay. So what is it that causes incontinence? I know you said there were several different types, but what causes it typically?
So there are a lot of types of incontinence, but it can be caused by simple things and then more complex things. So of course, I think we all know about the kid that is so busy playing, so excited to be on the playground at recess, and they just hold it, and then oops, I held it too long.
Right.
And then opposite of that, there are kids that gotta go right now. There's no holding it. If they ever have to go, it's urgent. Or peeing so frequently, so back and forth to the bathroom every 10 minutes. You pull over on the side of the road to let your kid pee. 10 minutes later, Mom, I gotta go. And they mean it, they have to go. So those are pretty typical, overactive bladder and just holding it too long. And then you have, girls in high school is like one big population we see. Only pees 1 or 2 times a day, hates the public restroom, will not pee at school, and so again, holds it too much. Or maybe the school just doesn't let the kid go to the bathroom. So there are like societal behavioral things that cause incontinence. And then also there are anatomical and neurological causes to incontinence. So you can be born with conditions of like the spinal cord that cause your bladder to work inappropriately, and that can cause it as well.
So you mentioned the road trip one, and I didn't prep you for this question. I have to throw it out there. You hear a lot, I just have a small bladder. I have to go more than a lot of people. Is there really a difference in bladder size? Is that an explanation?
So there is a difference in bladder capacity. So we have increasing bladder capacity if we're normal. As we age, our bladder capacity gets bigger. But when you typically hear someone say, I just have a small bladder, rarely is it that they truly have a truly small bladder capacity, but their functional bladder capacity may be small. What that means is they may get to a certain size in their bladder and they can't hold it past that. Can their bladder get bigger? Sure, but it's under pressure or they have an outside urge to go. And so most of the time, your child very rarely truly has a small bladder.
Okay. I was just thinking about adults. You hear that, like one can hold it for a 12-hour trip down to Florida and the other one has to go every 5 minutes. So it just triggered that question as a good tie-in. So you told me what causes incontinence. How would a parent know when it's incontinence? Like, is there such a thing as a one-off, like he peed his pants one time and that's not incontinence? But
Sure.
then,
I mean, it's an accident. It is
Right.
incontinence. By
definition,
it's
I
incontinence.
did look that definition up. So by definition, but I guess worrisome. How do you know when it's a worrisome incontinence?
So I think it depends. So it depends on the level of concern of the parent. Or, I mean, it can present in a lot of ways. So, you know, I think we all know of the kids that have been potty trained. My kid uses the bathroom, they've done great, and then all of a sudden they're having accidents. So that can be really overt presentation. They get their whole clothes wet, soaks them down to their socks. That's a very obvious presentation of incontinence. It can be less obvious. It can be, you know, you're finding wet undies hidden in the floor of your kid's room. You didn't realize why it smelled, and then you found these treasures. And that can be a more subtle incontinence, just leaking. And then I think some parents, you know, they never even get to that point of potty training. They're like, at what point am I supposed to be potty trained? And is this a condition? Is this like something I need to see the doctor for, incontinence? Because we just never really gotten a hold of it.
Just forever training, like just hasn't worked yet.
So I think that it presents in a variety of ways.
Oh, perfect. I double questioned you. I had to skip around. So you mentioned bladder control and potty training. I know when we start potty training, but what is the scientific, you know, age that they should be able to hold it?
So I love this question because there is not a scientific age at which they should
we don't
be
like
able
to
hold
hear
it.
that. We like to have like stats
know,
and facts
right?
and something to look forward to.
There are societal norms and there are social pressures at what age you should be potty trained.
But nothing in the body.
No. So, I mean, there are typical ages at which we see external sphincter control, pelvic floor muscle control, ability to hold it, sense it, and
We're
go.
getting to the facts area.
Yeah.
I like the facts area.
It's an average. It's different not only...
Because everybody's different.
Absolutely. And it's different in United States versus maybe in places in Africa. So it's cultural. Typically here, we see most potty training occurring between ages like 2 to 4. But that's an average. And just if you fall outside of that, that doesn't make you wrong. Right. Doesn't make you a bad parent. Doesn't make you a failure if your child's on the upper end of that.
Hey, take note of that. It doesn't make you a failure. Doesn't make you a bad parent. Every kid is different,
That's
right?
That's absolutely right. My child was easily 4.5 before we finally got it, and I'm a professional. So
yes,
it doesn't matter who
you
you are.
We love to hear that. We love to hear it.
Your child, it's an individual journey.
Well, and I have 2 kids, and one was very easy to potty train and one was not. So, I mean, just even within your own family, you can see the differences between...
Personality factors in, absolutely.
So, when do you know it's time to see the doctor?
So it depends on your level of concern. So you may say, my child is 4 years old and they've been potty trained and then all of a sudden we're having accidents. Well, I would say typically I start seeing children for daytime wetting around age 5. But if at 4 years old you've had a period where you've been continent and your child is now incontinent and it's obvious and you're concerned about that, you should come see me. Vice versa, if you have a 7-year-old who wets his bed every night and you know everyone in your family's done it and they all outgrow it and you're not that concerned about it, well, do you need to see me for that? You don't need to if there's no concern, if it's not bothering the child, if it's not bothering you. I mean, and these are things you can talk to your primary care provider about, but it really depends on your feeling and intuition as a parent or caregiver. There is nothing wrong with seeking advice for something that you feel is not normal or maybe something that could be treated. So yeah, if your child's 6 having bedwetting and feels the pressure of that and feels horrible about it, or if it's just economically taxing going through mattresses and sheets and you need one less stressor, is it wrong to go see me for bedwetting at age 6? Absolutely not. Absolutely not.
Awesome. I love this. I love your thought process on all this. It's so great. So they do come see you. Let's say they make an appointment. They want to come see you. How is this diagnosed?
So it's mostly diagnosed based on subjective history. So what that means is the majority of the visit, we're going to talk. We're going to chat. You're going to be asked 1,000 questions. And a lot of them are really funny. A lot of them are weird. And we try and make it as enjoyable as possible. We sometimes, depending on the presentation, will get like simple lab work, which, have your child pee in a cup, and then they will have that urine tested.
Just make sure there's nothing else going on.
Yeah, absolutely, because UTI or urinary tract infection can cause incontinence. So and there are certain disorders that can make kids make too much pee, so we'll screen for those. We may scan the bladder, see how good of a peer your child is. We may x-ray your belly, see how full of poop your child is.
That can affect it.
It absolutely can. Mm-hmm.
Things you learn.
Yeah. So typical first visit, you'll probably have a little bit of that. A lot of times we'll do a genital exam. That's a part of a complete workup. There are some things that can cause incontinence related to the genitalia. So I do think that it's reasonable to have just prep conversations with your child to say they may need to look at your private parts. Don't worry, mommy will be there, or daddy will be there, or I won't leave the room. It's okay. They're, a provider, they're a medical professional, that's their job.
Right.
And just have those conversations before. But we do take into consideration, the whole family aspect and social aspect before doing those kind of things. And we really make an effort to make it a very easy visit. And most of the time, it's super, super simple.
Great. And then how is it treated once you do get a diagnosis or you say this is a thing that's happening? What's the treatment for that?
Yeah, so there are several types of incontinence, like we kind of touched on, and treatment really depends on the type. We generally start with what we call behavior modifications in everyone, and those are the things you can do at home. Those are the things that you can kind of try before you get there. I mean, if you're having a child who is easily distracted and seems to always have accidents when they're outside playing, try like a timed peeing schedule. Set a timer like every 2 hours and send them to the bathroom and see if the accidents resolve. Treat underlying constipation. If you know your kid is a terrible pooper, that actually limits their ability to hold pee. So try and do some things to relieve the constipation. We may use medicines for certain types of incontinence. We may use physical therapy to help with muscle control and a variety of things. So it really just varies on each individual patient. Everyone's treated individually.
Yeah. So you mentioned changing the sheets earlier for the bedwetting. I know that this has to be a very frustrating thing for parents and the kids alike. I mean, they don't like it either, but it's very, very frustrating. So what can a parent do to help when their kid is going through this?
Yeah, so I think the important thing is to know that they're called accidents for a reason. They're not called on purposes. So negative reinforcement, disciplining, and punishments have been actually shown to be unhelpful and can even prolong the problem. I mean, we know that stress and anxiety prolong bedwetting and prolong incontinence. So creating that positive atmosphere, when kid says, Mom, I really didn't know I had to go, validating their feeling. They probably are telling you the truth. There are, of course, children that are out there that urinate on purpose as an act of defiance, but that is not an accident. That's an on purpose, and that's a different kind of treatment. But that is rare. So it is truly, truly involuntary. It's not something they want to be doing, and sometimes they'll act like they don't care as a coping mechanism.
Yeah.
So just creating that really positive environment and saying, hey, look, let's go talk to someone. Let's go get help. Or you're not in trouble. I just want you to be honest with me. I think are great conversation starters with kids.
I think that's great. I know this has to be hard to go through, but if you can keep it kind of positive, it's probably best for the parent and the kid.
Absolutely.
I would imagine. Now, one more question I've got for you. You mentioned that there were several different types of incontinence. Can you enlighten on that just a little bit?
Yeah, sure. So probably what we call functional urinary incontinence is one of the most common ones we see, and that's like the kids that are waiting too long to go to the bathroom, kids that may be constipated and have a small functional bladder capacity. There's urge incontinence, gotta go right now. There's some types of incontinence that have to do with actually the posture which you're sitting on the toilet. So it could just be something related to that. And then the most common one we probably see is bedwetting. So bedwetting is by far one of the biggest concerns that we see in our clinic. And that's because it's so common. I mean, even by age 5 to 6, 20% of kids those age wet the bed. So it's, normal is a relative term, but we see it a lot. And that's very personal. And so we treat that a lot. So I think the treatments for those and daytime accidents vary a little bit, but a lot of it's similar.
Awesome. You mentioned that was one of the most common things you see in the urology department. What else do you see? What is a common, if a parent makes an appointment for urology, what do you see typically?
Oh, so I think in my clinic, which is the dysfunctional voiding clinic, and we have a clinic here, we have a clinic in Northwest Arkansas for that, and then we also see patients in Jonesboro Clinic. for dysfunctional voiding. That encompasses like your accidents, your bedwetting, urinary tract infections, difficulty with urination, so like it hurts to pee or I'm having to push to pee.
Yeah.
So those would be the main ones that I see, and then of course we see a lot of other conditions related to the genitalia as well.
Gotcha. All right, I've got one more question for you, and then we'll let you go. So what do you love about your job?
I love helping families. You know, we often see on the news Arkansas Children's Hospital saves this heart patient, or you know, it's doing great things in the oncology department helping kids with cancer, and those things are so important, and it is so important to save lives. I think that we say that all the time, but you know, our mission here is just to take care of the whole child, and one of the things that matters most to them is having a normal social life, and if they're having accidents and they're embarrassed all the time, that's so personal, and they're so affected by that. So I love being able to help them with something that is as important to them as you know, curing cancer and treating heart conditions may be to the hospital as a whole. So I think it's important to remember that there's no too small of a condition. If you're worried about something, if something's bothering your child, you know, be empowered, seek treatment for it, because that's what Children's is here for.
I love it. I can tell you're super passionate about what you do. The kids that you treat are obviously lucky to have you. Thank you so much for joining us today. I learned a lot. I tried not to learn too much before I came into it because I wanted to let you teach me a little bit, and you certainly did. Thank you for joining us. You guys, thank you for joining us, and have a happy Friday.